Hey, we're back with Monday Motivation with Alice Creasy and Dr. Serena Chen, who's going to join me in just a moment. Hi, Serena. It's so good to see
Hey, how are
you.
you?
Doing well. So happy to have this chat. This is one of the tough things in IVF. You head into an IVF, you hope that you're going to respond really well to medications, but 25% of infertility patients fit into this category of not responding well to their stimulation cycle. This has to be frustrating for you too. When you start doing a stimulation cycle with someone and you expect them to respond well and then they don't. So
Yeah,
what is it, a diagnosis, or is it caused by infertility, or
it's
is it
more of an
just
opinion.
learning curves?
It's kind of an opinion. No,
Interesting.
um, I mean, like for studies, you have to decide on what is a low responder, and I think there's criteria like you can do a E2 estradiol level on day of HCG, number of eggs, number of follicles. It also changes with age, like somebody who's a good responder at 42 may, that same criteria you can't really use for a 25-year-old. So,
Got it.
it depends on how you're talking about it. But I think the big thing is, what your doctor expects you to respond a certain way,
Hmm.
given what your characteristics are and your age, and then you respond lower than that. I think the big thing mostly is age is our basic criteria that we use.
Okay, got it. So Kirsty, for those and Lauren, and for those who are just joining, we're talking about poor responders to ovarian stimulation when you do have a medicated cycle. Some people don't respond the way that they were hoping or the way that we expected. There was a time when I was supporting a BRCA positive patient, someone who was a carrier of the BRCA gene, which she had a breast cancer diagnosis, and then she found out she was a carrier of this gene, and they went all the way to egg retrieval, and there were no eggs.
Wow, that's awful.
It was so
BRCA
sad.
is definitely associated with a lower than expected response for age and other characteristics. That definitely is, there are definitely been studies on that showing that there is a strong association. Cancer in general um, seems often to be associated with a lower than average response, probably because cancer, patients are ill.
You're going
And
through a lot,
yeah,
exactly. And
yeah.
the body knows, and trying to overcome so much to try to stimulate more than one egg at a time to ovulate is
It's
already tricking the body,
it's a
let
lot of extra
alone
work.
it's a
Yes.
lot of extra work for the
Yeah.
body. Now, what
Yeah.
are some of the other causes, though, do we think of, poor
Smoking,
responders?
smoking is a big one. Smokers go through menopause of at least a year earlier than non-smokers, because we think that literally it causes death of the eggs, like it
Mm.
literally kills the eggs. So, smoke people who are chronic heavy smokers definitely have earlier rates of menopause and tend to have lower AMH levels for their age.
Okay, got it. Now, Sydney Chick, she just did a transfer and wants to know, when will she know if the egg implanted?
When you get the pregnancy test. Some people have symptoms, some people don't. It's really hard to tell.
And that's the hardest part about the 2 week
Yeah.
wait, Sydney, is, and
Yeah.
why doctors always say try not to test at home, just wait for that beta HCG level, because our minds play a lot of tricks on us. And I know when I was in the 2 week wait, every twitch, every feeling, I think it was so much mind over body kind of
Yeah, and
thing
if you think
where
about it, you're on all these hormones, so you don't know where those symptoms are coming from, and a lot of
exactly.
emotion. So other
Yeah.
other reasons for low response are just, chemotherapy and radiation.
Hmm.
Um, I do think that significant obesity impacts response. Is that because um, the amount of hormone that's getting to the ovaries is less because it's distributed through like a much larger body? Or is it just, there's so much inflammation going on because of the excess weight? It's hard to know, but excess weight can be
Mm.
associated with a lower response, although a lot of PCOS patients have excess weight as part of their PCOS syndrome, and PCOS patients tend to respond above average because their AMH tends to be above average. Let's see what else.
So interestingly, so weight alone, there's some mechanism there that we're not really recognizing then with extra weight in general.
Yeah.
Okay, so that's kind of interesting. We have a bunch of questions coming in though.
And then pelvic surgery, any kind of pelvic surgery, pelvic infection, history of PID, endometriosis also can cause a lot of damage to the ovaries. So all of those things can be
impact.
Associated. No.
Okay. Nurse Carly's asking, can you get a positive HCG with cancer?
There are certain cancers that actually produce HCG, certain types of cancers. So I'm not sure was that the question?
That was the question. And Nurse Carly, maybe you could clarify, are you asking, can you still get pregnant if you have cancer? And yes, there are people who find out while pregnant that they have cancer. And
that can be really tough because sometimes you're trying to, make a choice between the health of the mom and the health of the baby. And so that can be really, really difficult.
Yeah. Now, Fertility Affirmations asked, do we know what age range is more affected by low response?
Definitely, the older you are, the more common low response is because AMH, that's part of aging is AMH. No matter how high your AMH is, it always goes down as you get older. So, and ultimately, once you're menopausal, theoretically, then AMH will be 0.
Right. Boy, I'm not looking forward to that. And I'm sort of heading in there. I'm probably perimenopausal now.
You are not.
I must be. I mean, I feel like I am. But I think, that is the significant part is the age. And we bring this up a lot because we see all these mixed messages in the media of people who are 45 and 47 who are, celebrating pregnancies or even older. Yeah. And when we look at those from a patient advocacy perspective, and certainly as an educator, clinician, Serena's looking at it, Dr. Chen is looking at it, and we're going, yeah, that was an egg donor. Yeah. And so.
Yeah, but people don't seem to want to talk about egg donation in the press. So then it gives this misrepresentation that's really confusing. Right. And I think hurtful to people because they're like, well, why can't I do that?
Right. And we have to remember that there's a big drop in fertility at 35. And so every single year thereafter, we're in a decline. And it's not to give, this is called Monday motivation. It's not to give sadness to those of us who are, I'm 44, doing another embryo transfer hopefully this fall. And it's not to like tee us up for sadness, but it is so that we can all be empowering to one another, so that we can spread the word. That if parenthood is something you want without a shadow of a doubt, take the steps now. To make sure that you can, because the older you get, then the more likely it is that you won't get the response that you want.
Don't have a panic attack. Get informed.
Exactly.
Empower yourself. So
that's right. Now, Carla asked, she just did her 3rd insemination. I'm 38. I should get her test. She says she's going to get her test on Wednesday to see if she's pregnant. She's nervous. I know it's very nerve-wracking. Oh my gosh. That's the hardest thing about it during the wait is that everybody's like, relax, relax, relax. And then it's impossible to relax. You're nervous. It's, and you're putting all your hope in this, and it's her 3rd attempt. And it does sound like, Carla, that it was an insemination, so an IUI rather than an embryo transfer, I'm guessing. And so after, how many would you recommend she does of inseminations, Dr. Chen, at 38 before moving on to IVF and maybe doing
no more than 3, no more than 3. And then really strongly consider IVF, definitely.
Just higher success rates. And we've talked on other shows that if you look also at the cost associated, that even though IVF is more expensive all at once because of the repeated attempts at inseminations, it usually ends up being cheaper over the long run to just go ahead and do IVF.
Really, if depending on how their plan is structured, if they have IVF coverage and there's like a dollar limit, then your money is definitely much better spent on IVF. It's the cost per baby is a lot less with IVF because it is so much more successful.
Right. Oh. And then Beezer11 asked, any advice for getting pregnant for those with PCOS? So we have a lot of PCOS content that we've done, but maybe we can kind of associate this, that poor responders aren't usually PCOS patients. Well,
PCOS is similar to other people, but it's more highlighted that healthy diet and weight management plays a really, really critical role. But most PCOS patients, a lot of them are not ovulating. So you need to see a doctor so you can,
Make
get
sure you're
ovulating.
ovulating. Exactly. Yeah. And one of the things that we just talked about last week, is Uva Life has a product out that can tell you, it's uva.life, that can tell you if you are actually ovulating. So a lot of the ovulation kits, they only test one hormone, LH, but women with PCOS have LH all over the place. This actually it's very personalized to you, and then it'll tell you if you are ovulating or not. Because it actually measures your progesterone level throughout your cycle.
And it's quantitative instead of just yes, no, like those normal kits at the
That's right.
Drugstore. The drugstore kits are just yes, no, and for PCOS patients, it's all over the place.
Exactly. So we're really excited about your, check that out, uva.life. We also have that interview is in our IGTV as well. Sydney Chick talked about how much water should she be drinking, and can she drink soda water?
I usually, I don't know. I feel like soda water causes a lot of gas, but it's a little bit more acidic. But so some soda water is fine. But I usually say 2 liters of water a day or more. Obviously, if it's really hot out.
Yeah, right. If you're exercising a lot and you're doing a lot of sweating, replenish.
Yeah.
Now, I think this is a great question from Noble Diaz, who says, "Can losing weight help with the treatment response?" So, if you do feel like weight is maybe part of a low responder, do you typically see improvement? Yeah.
It might be helpful to get to a healthier weight, although I don't want people focusing so much on the number.
Yeah, exactly.
Like not to beat themselves up over the number, but more to work on a healthier lifestyle.
Right. Yeah, exactly. So hopefully that was helpful. You can ask follow-up questions, of course. This is great. We love it when you guys ask a lot of questions. This is what we're here for. Let's see. Can vaginismus vulvodynia, I hope I even pronounced that correctly, Nicola, affect fertility, including Botox trigger point injections in the pelvic floor?
So I don't think there's been a lot of studies on the Botox injections in the pelvic floor. And personally, for vaginismus and vulvodynia, you should see a specialist that specializes in that. I've had a tremendous amount of success with the physical therapist doing pelvic floor dysfunction physical therapy to basically train you, because vaginismus is a trained response, and you can be untrained to have a more functional response so that your pelvis doesn't go into spasm when there's insertion of the penis. But obviously, if you're having terrible pain with intercourse, you can't have intercourse, then that could definitely affect your fertility. The Botox injections usually are not, we don't usually want to do them during like pregnancy and things like that, although theoretically they're just local and should not impact anything. But I think, you wouldn't want to do them during pregnancy. Prior to pregnancy, I think people would say there's just no data, but physiologically it might be reasonable if you feel like they're really helpful. But we would say the first line of therapy is physical therapy, and also talk therapy and sex therapy before we would be doing Botox injections. That seems like more like a tertiary treatment.
That's a great answer. Thank you for that thoroughness too. Kirsty's also asking, yes, we can do a live on secondary infertility in the future. We've talked about secondary infertility before, so also check out our YouTube channel under Fertility Answers. We do have some talks that we've done on that, and we're happy to do another one.
Right?
We did. Yeah, we did. We covered it. Yeah.
It was a good one.
It was. So yeah, check it out on YouTube, but we can always do another one too, so you have a chance to ask all your questions. Lauren asked, after a healthy embryo transfer, she had a blighted ovum miscarriage. I hate that. Oh, I'm so sorry. Yeah. Currently, her HCG is down to 11. She'd like to know will her period come back when it returns to less than 5, or might she get it sooner?
Sometimes it comes back now because 11 is low enough that it's not going to inhibit ovulation. So you should be careful and don't get pregnant until you're really 0 and your doctor clears you for pregnancy, because you could ovulate now with the beta that low.
Oh, but we're so sorry, because that is, that is really heartbreaking. I had a friend who went through that last year. All right, let's see. I'm scrolling up through our questions and trying to wave at everybody. Biggest piece of advice for a couple starting IVF. Her husband and she start in 2 weeks. Congratulations, first of all. We know it is a daunting process, but they're starting in 2 weeks. So eat healthy. Get all your self-care lined up. You know, this is a clinical experience. You know, there's going to be a lot of information, a lot of, you know,
calendar and your plate a little bit.
Yeah.
So you know, your to-do list is not torturing you to death.
Exactly. I mean, anything that you can do to reduce stress during that time. So it's a lot of self-care because, you know, if we just say reduce your stress, I mean, you know, that is far too large of a mission to just reduce stress. So look at self-care that you love doing, you know, whether it's Epsom salt baths or lighting a candle or, you know, your favorite TV show or reading a book or massage, right? We just want you to do a lot of self-care during the time to try to, you know, minimize stress as much as possible while you're gearing up for your retrieval and your cycle. But certainly those healthy habits, we talked a lot about those as well, right? Yeah. And how to eat. I would say, like, you know, eat a lot of omega-3s.
Yes.
A lot of flaxseed.
I like to cancel meetings.
Yes, that's self-care. Cancel meetings. That's a great one. Cancel meetings. That is a good one. Definitely. Yeah. And also I think with when it is a partnership, you know, when I embarked on my journey, it was fertility preservation first. And so I was a single woman at that time. And then it was a frozen embryo transfer as a single woman. If you're in a couple and you're in a pair, you know, talk in advance about things that you can do together, because the woman is going to be going through a lot, and there's lots of things that the partner can help with, whether it's a female partnership or it's a female male partnership that the partner can participate in that will make you feel supported. And also, there's some good emotional programs too.
I know it's very private, but it's nice to have like a little inner village or a little circle of people that know what you're going through, so they can be extra nice to you.
Yeah, exactly. Yeah. Now, Barney wife asked, can ovarian cyst removal help fertility? She does have PCOS and had 2 large ones inside her ovaries recently removed.
Sometimes it can. It's interesting, in the old days, before we had a lot of effective medications, they used to actually cut out pieces of the ovary, and this is also an ovarian drilling is a more recent iteration of it. It sounds like the cysts you had removed, if they were large, they were not due to PCOS, because PCOS cysts are not really cysts, they're just little follicles. So we don't recommend cyst removal as a primary treatment to improve fertility. We would recommend cyst removal if, you know, there's a concern and like they just need to get the cysts out, you know. So that's a little bit of a roundabout explanation, but I would say sometimes cyst removal can be helpful, but we wouldn't be doing cyst removal in order to improve fertility, because surgery can impact the anatomy of the pelvis, increase scarring, you know, and obviously it's an invasive procedure. So all of those things have to be taken into account. And so that is not a primary fertility treatment, but if you need a cyst removal, sometimes you might see some improvement.
Okay. Wanted to go back to a question on poor responders. Is there a connection to early pregnancy loss if you are a poor responder?
Is there what?
A connection to early pregnancy loss if you are a poor responder?
You know, some people think there is I think it's actually a little bit controversial. Some studies say yes, and some studies say no, but there's a lot of overlap between poor response and age, and early pregnancy loss is, even in super healthy, super fertile people, is super common.
Yeah. I mean, I have 5 of them.
Yeah. It's a little bit hard to know for certain, but there does seem to be some association between poor response and pregnancy loss, although it's not necessarily direct in every person. I feel like there are probably some different pictures.
It does actually. A follow-up question to that is, if you're a poor responder the first cycle, what do you adjust heading into the second cycle? Is it expected you're going to be a poor responder each cycle, I guess is my
Not necessarily.
question.
That's a really good point, because sometimes you can not necessarily go up on the medications, although if you're not at a maximal dose, then you can go up. We feel like a maximal dose is about 450 units of gonadotropin a day. So if we feel like going over that actually can be harmful, and the negative effects outweigh the positive effects. So you can't just keep going up and up and up.
Sure.
But adjusting the medications, and sometimes, people respond better to one regimen versus another. And the hard part is it's usually empiric. We can't tell ahead of time which regimen is going to be good for you. So some of it can be a little trial and error. And sometimes they're just cycle variability. Like sometimes we have these donors on exactly the same medication cycle after cycle after cycle, and they can have very different responses.
A friend of yours, you and I had breakfast with a friend of yours at a conference who used the term shower, not grower. And it reminds me of this topic because you have the data that you have, and you go in and you have these follicles and you think, okay, I see these follicles, right? But then they end up not growing.
Yeah. And you're like, what is that?
And it's confusing and it's disappointing. And, that would be an example though of you kind of think somebody's going to respond a certain way and then they don't. And
we've had the opposite where we think they're going to have a terrible response and they have a good response, or that we really feel like, oh, that ovary doesn't look so good. And then next thing you know, there's a lot of eggs. And the cruel twist of nature, or cruelty of nature, is such that as you get older, you tend to make less eggs, and yet the older women need more eggs because it's harder, to get the normal one.
The quality.
When you're 25 years old, you probably don't need to get that many eggs to get a good one. But the 25-year-olds respond better.
Right, of course.
It's
that is the cruel part of nature. You're right. I like how you phrase that. Run for endo. We have a question. Her gynecologist removed one blocked fallopian tube due to a previous ectopic. Very sorry to hear about that, because that's so traumatic when it happened. So I hope that you've gotten some good emotional support afterwards. She'll be starting Visan medication, if I said that correctly, next cycle to manage adenomyosis. Right? I said that right. Okay. Could she still fall pregnant without IVF?
So she'll be starting
a medication, Visan. Visan is a medication. I don't know that one.
Yeah, I don't know that one either.
Okay.
But you could get pregnant without IVF. Your risk for ectopic pregnancy, instead of being the normal 1 to 2%, is 15 to 30% because you've had a previous ectopic pregnancy. So that definitely decreases the efficiency. But if the other tube looks good, you could definitely get a normal intrauterine pregnancy without IVF. You just have to be watched super, super carefully. IVF would definitely be more efficient, because the ectopic pregnancy with IVF would be, only 1 or 2%, and the pregnancy rate with IVF is much higher than in Mother Nature or with any other treatment. So it's just, more efficient.
Got it. Okay, perfect. Okay, let's see if there's other questions scrolling down. Thanks everybody for joining. Trying to wave at everyone. We do. We love all these questions. Okay, and good. So Carla wrote back and said she's thinking about doing IVF if her third insemination doesn't work. That's clinically what's warranted, Carla. So
that makes sense.
What we don't like seeing is people doing too many IUIs, knowing that the success rate is
pregnant this time.
Yes, fingers crossed, and you'll let us know. Yeah, exactly. Why is it bad to get pregnant with HCG still being high after a miscarriage? Is it because there might be fetal tissue remaining?
Yeah, there could be it's more commonly decidual tissue, like the lining of the uterus, lumps or bumps, that could increase the risk for miscarriage next time. So if pregnancies are too closely spaced, there does seem to be a statistically increased risk of having problems the next cycle, and that's probably because we see this maybe debris or polyps left over inside. The other thing is a lot of infertility patients tend to be high risk, and therefore we're watching their HCG really closely and trying to really make decisions about what to do about your pregnancy, about whether it's healthy or not, based upon what we know about exactly when you got pregnant. And if you never go to zero and then you start going up, it's going to be super confusing and can be a little bit hair raising, because then we're like, oh,
We don't know.
what's going
You're
on?
right.
You know, could you have a tubal pregnancy? And, you know,
Right.
so we really want we want the first pregnancy to be completely resolved and the uterus cleared before you move on to the next one. We feel like your chances of having a healthy pregnancy next time are better, and our ability to help you is better.
Yeah, that makes so much sense. You have to have a clean slate.
Yeah.
You need clean data in order to do your best job.
Yeah.
And if there's not kind of clean data, then it's more difficult. EMK, you're welcome. So glad you found the advice about how to prepare for your upcoming cycle, which we hope goes really well. Helpful. And then Beezer had another question. Any opinions about the Mosey baby syringe? I'm not familiar with the Mosey baby syringe.
I don't know either.
Is that
so?
Yeah, send us a picture.
Tell us about it.
Let us know what it is.
Sounds interesting.
Is it an at-home insemination kit?
Do you think it's like something that injects sperm into your vagina? Maybe it's something like that.
I'm thinking it's that. I'm thinking it must be.
But I've never heard of it. But if you're having normal sex, you don't really need a baby syringe to get sperm into your vagina. But, you know, if you're not having normal sex and this helps get sperm into your vagina, that might be helpful. But
I don't love the term normal sex. I don't like that. What's normal
like
sex?
Vaginal,
I mean,
penile to vagina penetration.
Okay, that's more accurate. Okay, that's more accurate. I don't know. Normal feels
cisgender.
Right. That's more accurate.
Sorry. I'm being imprecise.
Yeah, well, we often in our field try to move away from things like natural versus unassisted.
That was like so.
Which is a slip of the tongue. That was.
It's been a long day. And
yes, I know.
Now I'm politically incorrect by the end of the day.
It's already 6 p.m. for Dr. Chen, so we'll wrap it up with just one or two more questions, and then Natalia asked, "What is the best way to get pregnant if you do have a translocation?" This is such a good question because we were just advocating genetic testing.
So that would be IVF with ICSI and pre-implantation genetic testing for the translocation. It's called PGTSR technically by the PGD International Society, because that stands for structural rearrangement, and that's what a balanced translocation is. You have all your normal chromosomes, but like a little arm from one chromosome is attached to a little arm from another chromosome. So because they're stuck together, and the sperm and eggs need to line everything up perfectly and then divide everything up perfectly so that the eggs and the sperm get exactly the right amount of chromosomes. If you have something stuck together, it doesn't ever divide evenly, and it really dramatically increases your risk for infertility and miscarriages. And using PGT, or genetic testing of the embryos, in the IVF lab, we can find the ones that are balanced. So.
Yeah, that was a great explanation. And we do have what we call economically conscious genetic counselors. If you haven't had a counseling session about your translocation that can help you with kind of all these next steps, then certainly reach out. It's atgc.com. They're one of our strategic partners that we selected. They do all telephone genetic counseling. So you just stay home and they will review your results and go through that preconception genetic counseling with you so that you know what questions to ask when you get to your IVF clinic, and so forth. So we're here to support that. A couple great questions just came in from Laura and Patty that are a little bit similar. Just where to start, not
with Fertility Answers.
Yeah, well, exactly.
Well, definitely you guys know everybody, right, Alice? Like, how many reproductive endocrinologists do you have?
Yeah, I mean, we have about 50% of the IVF clinics, that are engaged in the platform in some manner. So we have about 367 experts on the platform, and about half the clinics in the country we can connect you to any clinic in the country, no problem, and we're happy to do that. But I think Laura and Patty, the place to start is getting the data that you need about your own body to know IVF is not the only assisted reproductive treatment. And so going through the diagnostic process and getting the right type of consultation done with an actual specialist, that's where we start. We start with the specialty consult because the OBGYNs are not trained in infertility the way that these doctors are. And so what we want is we want to make sure that you have a thorough workup that includes, looking inside your body and looking at your blood. In some cases, working with our naturopath who can look at your heavy metals, who can detox you, who can look at your gut microbiome. But it starts with knowing your data and knowing your body and your picture of what's going on. Sometimes there's not even a diagnosis, right? That's unexplained infertility that,
And sometimes people just need some advice and to get healthier,
That's right.
So it's, and even if you do need treatment, it's important to know that the treatment decision is up to you. It's not up to the doctor. So
exactly.
The important thing is to get the information.
That's right. And I think it's so important for everybody to know that just because it's an IVF clinic and an IVF specialist, I think those are sort of shorthand words. It doesn't mean that they're going to sell you IVF. We don't even actually accept anybody who only wants to do consults for people that they can talk into IVF. We don't let them be on our network. The most important thing is that you get that proper specialty consultation. When I was going through cancer, I wouldn't expect my primary care doctor to treat me for cancer. I went to an oncologist. If you have high cholesterol or a heart problem, you go see a cardiologist. If you have trouble conceiving without assistance, you go and see a specialist in infertility. So that consult truly is that first step. And we can book you with telemedicine consults. We can book you with a virtual consult. As a first step, you can do first opinion consults, second opinion consults. Certainly just reach out to us, navigators at medanswers.com or DM us, right on the Instagram platform, and we'll connect you to our navigator who will help you find somebody either in your local area or out. The other thing I want to say about that is a lot of people don't even go in for the consult because they're afraid they can't afford treatment. We are masters at helping with that. We have medical tourism clinics all over the country and all over the world, but we also have financing lined up in case people need it. So there's all kinds of ways that we can help when it comes to affordability and accessibility. So please, we don't want anybody to not get a proper medical consultation, because the media has done such a terrible job of making us all feel like we're not going to be able to afford treatment, and we don't even know what type of treatment that is going to be warranted.
You got to get the information. So important to be informed. You can't make any decisions without it. Yeah,
exactly. And you're welcome, Patty. I'm so glad you found that helpful. So let's take this last question, and then we're going to let Dr. Chen go get dinner. Let's see. Can a myomectomy and endometrioma removal affect your chances of getting pregnant naturally? Does any of that affect ovulation?
So a myomectomy, if it goes through the abdominal wall, if they do a skin incision, that is pretty high risk for scar tissue. Endometrioma removal is pretty high risk for scar tissue and possibly for impacting ovarian reserve. So you definitely need, if you need surgery, you definitely should get a second opinion, and you definitely should see a fertility specialist before you actually get the surgery. And a lot of people, because myomectomies and endometrioma removals do have significant potential for impacting your fertility negatively, a lot of people will freeze eggs or recommend freezing eggs before these surgeries because there could be a significant impact. Now, a fibroid that's inside the uterus that can be removed through the vagina, that's a relatively simple surgery. It does have to be done by a skilled specialist who really understands how to do that type of surgery, but that usually improves your fertility. So the role of surgery is a very, very complex one and really has to be individualized and is invasive and could have a negative or a positive effect on you. Depending upon how it's done, and you really, really, very important to see a specialist, very important to get a second opinion, I think.
Yeah, absolutely. Nikki, please reach out if you want us to help kind of navigate that and talk a little bit further about it. And Laura, you're welcome. We're so grateful for every one of you. We're here to support your path to parenthood, no matter what it looks like. Please join us on the Fertility Answers app. You're anonymous on the platform when you ask your questions, but it does help us get a chance to know you a little bit better there. And as always, thank you, Dr. Chen, for being a part of these Monday
Great
Motivations.
Yeah,
awesome questions. These
Yeah.
are so fantastic. And we will see you guys hopefully next Monday, same time. Tomorrow, I'll be with Dr. Raquel at 4 p.m. Pacific time. I always get my time zones mixed up when I'm talking to you, lady. And, you know, we always talk about naturopathic things,
Alice,
but
what
she's still an MD.
are we going to do? Are we taking a break on Labor Day?
Oh, I forgot. Next week is Labor Day. So should we take a break? Well, if you're out, we can take a break. Do we need a break?
Let's just text over the weekend. We'll
figure it out. All right. We love you all. We're here for you. Thanks so much. Bye.
Bye.